Welcome back. With us right now from Harvard Eye Associates is Dr. Teymoorian. Good to see you, sir.
Good to see you again. Thank you again for having me.
Yeah, it's always nice to see you. Today, you brought a few slides along, and we're going to talk about glaucoma, right?
Yeah. Well, actually, I want to raise awareness for glaucoma because January is National Glaucoma Month.
Okay.
What people always ask me about is, they're trying to better understand glaucoma. There's actually over 40 types of glaucoma, and that's where you have high pressure in the eye that causes damage to the fragile nerve that transmits the signal from the eye to the brain.
Okay.
If that's not taken care of, that can eventually lead to parts of your vision that's lost or eventual blindness.
So, wow, 40 types? I wouldn't even fathom those that many. I thought there was like a couple or something.
Yeah, well, we like to think about it deeper down to try to break it down into smaller pieces.
Okay.
But there are 40 types, generally 2 types that are subtyped into 40 types. The treatment options, though, are generally the same. To bring the eye pressure down, which would include eye drops, laser, and surgical procedures.
Okay. So first of all is how do you detect it, and how early on is it? Obviously the earlier the better, but at what point can you folks, when you're doing an eye exam, can detect that and start doing something about it?
The most important advice that I can give is for people to have them come in and have their eyes checked, because the early signs of glaucoma people don't notice at all. It's just the eye pressure is just a little bit higher than ideal, and that's causing very gradual damage to the nerve, but it's so early on that people don't notice anything.
Right.
So what I never like to hear is when a patient comes in, they're saying, I'm not feeling like I'm seeing quite as well. That's a sign to me it's not just early glaucoma, it's already advanced glaucoma. So really the best advice that we can give is to raise awareness for people to come in and get their eyes checked. That's really the only way to figure out whether people need to be treated or not.
Okay, so we got a slide here that shows what glaucoma is. So if you can explain it, first let's look at the kind of the cutaway of the interior of the eye.
Sure. So that's the transitional section here of the eye. Most important thing that we want to look at here is the optic nerve. That's again on the right-hand side.
Okay.
That's what again is what's relaying the information from the eye to the brain. Really what's happening here in the eye, there is a production of fluid in the eye, which the eye does need to make, because that's what's nourishing the eye. It's just the release of that fluid isn't balancing out the inflow and outflow. Which means the pressure or the fluid builds up, that means the pressure builds up, and then the sensitive nerve in the back is damaged. And eventually if you lose enough of the nerve, then there's parts in your vision you start to miss, generally starting in the peripheral vision first, and then gradually getting worse and worse. The way I think about it here is, think of your cable line, your TV line at home. The cord is made up of many, many different little fibers.
Right.
You lose certain fibers at a time with glaucoma. For instance, at first you'll lose a couple of channels. Maybe you'll lose the sports channels. Then maybe you'll lose the TV or the news channels. Eventually you'll notice, hey, I'm missing more channels. I'm not longer able to get them. Then it starts to affect your quality of life.
Okay, so one of the questions I have is, what causes it? Is there anything that can be done to prevent it? Is it hereditary? Is it just something that some people get, some people won't?
That's a good question, and that's what makes it really difficult. We wish there was a cookie cutter way of treating glaucoma, but because there's so many different types out there, all the way from hereditary causes to infection causes or even cancer causes, it really depends on what's causing the glaucoma and how we go about treating it. The treatment options, though, again, are still the same to bring the eye pressure down. Patients will always ask me, how do I do well with this disease? And there's really 2 things that I consider the secret sauce to glaucoma treatment. Is one, to keep your appointments, and the other is, if you're using eye drops, make sure to keep your eye drops.
Okay, so we got some different eye drops here and how you treat it. Another question I have, actually is kind of a 2-part. Will it affect both eyes the same way? And can you get to the point where it can be eliminated?
That's a good question. I'll start with the latter first.
Okay.
It can, for the most part, affect both eyes. Generally, it's one eye worse than the other, so they don't have to be symmetrical, but it can affect both eyes.
Okay.
When we treat glaucoma, we think of it as a spectrum of ways of taking care of it, all the way from eye drops to surgical intervention. What we're trying to do, though, is come up with better ways of taking care of our patients that don't rely on this, ways that are more effective but are less risky. And those are some of the things that we're excited about, that we're working on, that's actually recently come out.
Okay, so that's good to know. Surgical, you mentioned. when do you know, or when do you determine we need to get to that? You need to get to that point. And during surgery, what happens? Do you put like some sort of a release valve in there, so to speak?
That's a good question. And again, for every patient, they're different one to the other. One of the earliest ways we take care of glaucoma is actually with cataract surgery. And most people will say, why are we talking about my cataracts when we're talking about glaucoma? Cataract surgery is actually the first line glaucoma surgery. Irregardless of mostly of the type of glaucoma you may have, taking care of the cataract for patients is going to be the first step. Usually it allows people's eye pressures to come down a few points, which is beneficial to us.
Right.
And should they need the bigger glaucoma surgeries later on, they work better when the cataract's already removed. So again, first line glaucoma surgery is cataract surgery, very common thing to talk about. Depending on the type of surgery that we're doing, there's many different options. Some of them involve putting a stent in, some of them don't. What I sort of alluded to earlier in the segment was there are newer devices or stents that have come out recently that allow us to better take care of our patients. And this is a good way of illustrating it. On the top left would be the eye stent, which was something that was available to us a few years ago, back in 2012, really paved the way of doing what we call MIGS procedures, or minimally invasive glaucoma surgery. Two other stents have recently come out too, on the bottom left, which would be the Zen implant, and on the top right, which would be the CyPass implant. All of these have different types or spaces within glaucoma care that allow us to better take care of our patients. So although we would love to have a cookie cutter approach to taking care of them, all of these things add to our armamentarium of how we can take care of our patients.
And really looking at especially the finger and the penny, how small these are.
Yes, actually, to bring out one point about the eye stent, that length of that stent is 1 millimeter.
Wow.
So even under the operating microscope that we use, it looks really small. And then when you get it out onto a penny, it's really small. It's what I've known to be is the smallest stent you can possibly put in the body. It's incredibly small.
Wow.
Yeah. Again, we're trying to...
It seems like it'd be difficult to get in.
It definitely takes some training to do.
Yeah.
But that's the part that we're trying to do. You know, as doctors, we're always trying to take diseased tissue and make it natural again, without it ever look like we're doing anything in the body. It's stents like this that allow us to truly do that.
Yeah. And once you get a stent in, let's say somebody needs this procedure, is it something that has to be redone every few years, or it just depends?
Yeah,
or widened, or whatever it might be?
Yeah, it depends on the patient. Usually these stents, once they go in, they stay there. The question is, if the disease gets worse for one reason or the other, what additional procedures do we need to do? And that will vary one patient to the other.
Okay. Now, if glaucoma is managed and is managed early, are the long-term results pretty good, that somebody will keep their eyesight?
Generally it is, and that's probably one of the biggest common misperceptions that I think patients have when they come in to see me. They're very anxious. You know, they've read online that because you have glaucoma, you're going to lose your vision for sure. That's not the case. The case is if it's caught early and it's well taken care of, people can do well. It's just a matter of figuring out, do you have it, which is why we want to raise awareness for people to come in, and what do you need to do well? And just as we had discussed earlier, the two things people can really do to take care of themselves when it comes to this: keep their appointments so we know things are going well, and also use your eye medications if you're on them. If we generally do those two things very well, 99% of the time, this issue gets addressed, believe it or not. The biggest issue we run into is just patients not necessarily coming in when we'd like for them to come in, or just having difficulty one reason or the other with the eye drops, which is to be expected. The question is, it's easier if we know people are having trouble. That way we know how to address the problem.
Right, exactly. You know, speaking of that, in just a moment, we're going to show a segment where I came over and had an eye exam.
Yeah.
It was, I guess, would be called a routine eye exam. Is this the time that you folks first notice there could be some kind of problem?
Yeah, and that's what it requires doing, is getting your eyes checked, which include a couple of things: checking your eye pressure and looking in the back part of the eye to where that nerve is that we had discussed earlier.
Okay, and I remember in the eye exam, which we'll show, you put some kind of fluid in there, some greenish. Is that part of a glaucoma, or is that something else?
Yeah, there's many different ways of checking eye pressure. That's one of the eye drops that we use to make you comfortable while we do the exam.
Okay, very good. Well, you know, we know how important this is, and of course the key is keeping your eyes examined. Now, if you go in as I did, and except for maybe me getting a different prescription or something like that, but everything is clear, should you wait another year? Is it 6 months? How does that work?
Some of the diseases that we talk about in the eye are more common as people get older.
Okay.
So I would say yearly exams would be the way to go. Even if that means, hey, everything looks good today, we'll take it. A lot of the prevention that we can do for our patients needs to be done early on. But the more we do it earlier, the less we need to do it later on.
Okay, very good. And, I can attest to the fact that, it's very comfortable, all the different, the whole eye exam that you do. And it's just advanced so much compared to what it used to be even 5, 6, 7 years ago. Right?
It is, and we understand patients are anxious coming to a doctor's office to be seen, so we try to make the experience as best as possible.
Yeah, and you guys do, and we'll show that to you in just a moment. Always good to see you.
Thank you again for having me. And again, I want to wish you and everyone at the studio and your viewers at home happy holidays and a good New Year.
All
Be
right,
safe.
you too, and please extend that to your family and all the folks over at Harvard Eye. We'll see you again in the new year.
Sounds good. Thank you again.
And coming up, we're going to bring you that segment where I go over to Harvard Eye, and this gentleman right here is the one who gives me the eye exam along with a couple other people that helped out as well. But it's a real easy, comfortable procedure. Not even a procedure, I shouldn't even say that. Comfortable exam, and definitely, as Dr. T has said, it's important that you get your eyes examined. All right, we'll be right back.